Hello and welcome to the Clinical Medical Assistant, Chapter 15, the Musculoskeletal System and its related care. In this chapter, we will be discussing the structure and function of the musculoskeletal system, and we will also discuss some of the related conditions in this body system. Also, if this was a specialty that you were working in, this would actually be the orthopedic specialty. And also, we will have a case study. So, you want to grab your case study paperwork, and we will navigate through this chapter together and complete those case studies for you to turn in to your instructor on your next in-person day. To be successful in understanding this chapter, I recommend that you have your book open and available, have your notes, a pen, and a highlighter. And as we go, you can highlight some of those key points. So let's look at our first case study we have on page 214. We will have Kenji as one of our case studies here. And so Kenji falls from a ladder while painting his house and injures his right leg. He calls Hartman Physicians Group to make an appointment with Dr. Smith. He complains of pain and inability to walk on the leg. Rick, Dr. Smith's MA, gives him an appointment for that afternoon. Kenji's case will be used to illustrate key points in this chapter. Okay, so let's look at some um, uh, terms as it relates to this body system. And so bones are rigid connective tissue that makes up the skeleton, protects the organs, and allows the body to move. And so I want you to begin to just think about some of the bones in our body that protects certain organs in our body. Joints is the place at which two bones will meet. And then synovial joints is a type of joint that allows movement. It is surrounded by a cavity called a bursa that is filled with synovial fluid. Then you have the cartilaginous joint. It is a type of joint that does not have a joint cavity and is only slightly movable. And then you have a fibrous joint, which is a joint that does not allow movement. So, for example, joints that are between cranial bones. Muscles are groups of tissue that provides movement of body parts, protection of organs, and creation of heat. Fascia is a tough sheet-like connective tissue that actually covers the muscle. So this is a picture of the human skeleton. And so here are some points to remember as it relates to the human skeleton. Bones are the rigid structures that protect internal organs. The human body contains 206 bones. We do not expect for you to know all of those bones. Blood is produced inside the spongy bones or the trabecular bones, which contain blood-rich red marrow. Two bones meet at a joint. There are 300 joints that allow different areas of the body to move in different ways. Voluntary muscle movement is made by skeletal muscles. So, for example, when you are walking, involuntary muscle movement is made by smooth muscle. So, for example, when your heart is beating, that is involuntary. And then skeletal muscles use an agonist or an antagonist system for movement. All right, and so this handout just kind of talks about the different types of synovial joints, which we talked about in the beginning. What are synovial joints? And that's the type of joint that is surrounded by a cavity. And so you have a ball and socket joints, which allow for movement in all directions. So, for example, the hip and the shoulder are examples of that. You have your gliding joints, which are between bone surfaces that are flat. The movement is a sliding movement. So, for example, joints between the tarsal bones in the foot and between the carpal bones in the wrist. You have the hinge joints. They work like the hinge of a door. They allow back and forth movement. And so the knee and elbow are examples of hinge joints. Then you have your pivot joints, which allow for back and forth rotation. The joint between the vertebrae of the neck is an example. This joint allows for the head to turn. Then you have your saddle joints, which are named for their shape. The bones fit together like a saddle and a rider. They allow movement in two planes. So the joint where the thumb joins the hand is an example. And then I think I missed one, which is the condyloid joints, which allow movement in two planes. So for instance, front to back, side to side, joints in the wrist and in the knuckles where the fingers join the hand are examples of the condyloid joints. All right, and so here is a picture of the skeletal muscles. Okay. And so the musculoskeletal system allows these basic body functions. They allow for abduction, they allow for adduction, they allow for extension, dorsiflexion, plantar flexion, rotation, internal and external rotation, and pronation. It also allows for supination, and you can kind of follow right along in your book. You can see the different exercises that I am speaking of here. I call these range of motion exercises. So during your study time, you can look at each one of these definitions and you can see what that exercise consists of. It allows for inversion, eversion, opposition, elevation, depression, and circumduction, along with hyperextension. So let's begin to look on page 217. With Kenji, who we're studying here. So Kenji reports pain in his lower leg that increases with movement. During his intake, Rick notes swelling of the lower leg, including the knee joint. What type of joint is this, and what movements can the knee joint make? Okay, so that is something to answer in your case study. Again, go back and look at your synovial joints and the different joints that we have already discussed in the beginning of this lecture. All right, and so now we're going to move on here. We're going to discuss lifespan changes to the musculoskeletal system. And so cartilage is a flexible connective tissue that makes up of the skeleton in an embryo and eventually becomes bone. And then ossification is the process of hardening into the bone. So these are the normal changes to the musculoskeletal system over the lifespan. Ossification, which is hardening of cartilage into bone, is typically complete by age 21. Gross motor skills, which is the use of your larger muscles, develop first, and then your fine motor skills, which is the use of your small muscles, will follow that. Normal changes to the musculoskeletal system beginning in middle adulthood include the muscles will begin to weaken and we may begin to lose muscle tone. The body movement slows, bone loses density and become more brittle. So I want you to think about what your patient is more at risk for if their bones become more brittle. There is a safety concern here. Joints can stiffen and they can become painful. Actually, height is gradually lost. So yes, you do shrink as you get older. Exercise helps maintain strength and mobility. Smoking can contribute to premature aging of body tissues, and poor nutrition and inactivity can negatively affect bones and muscles. So now let's talk about some of those specialists who will work in this field and who you will be working in this field. And so now we're going to get into some of those chronic and acute conditions of the musculoskeletal system. So anytime we speak about bones or anything like that, you hear the word ortho. And so an orthopedic specialist is a physician who diagnoses and treats bone disorders. So again, this is our orthopedic specialty chapter. Rheumatologist is a physician who diagnoses and treats inflammatory and debilitating musculoskeletal disorders. A podiatrist is a physician who diagnoses and treats disorders of the feet. Osteoarthritis is a common type of arthritis. So remember, anytime you hear the itis, this is inflammation. So this particular arthritis affects the hips, knees, fingers, thumbs, and the spine. And it is also called DJD, which you'll hear a lot of in this specialty or this area, which is degenerative joint disease. Other common things that we will hear is rheumatoid arthritis, which is an arthritis where the joints become red and swollen. Again, itis. Um, Gout is a condition which is a buildup of uric acid in the joints, and then bursitis is inflammation of the sac that surrounds and protects the tendons. And we kind of mentioned that in the beginning. Tendonitis is inflammation of the tendon and its connection to the muscle and our bone. And again, we have inflammation, your itis. You have plantar fasciitis, which is inflammation of the fascia on the bottom of the feet. And then orthotic is a device that supports a body part to assist with mobility. So everything that we just named are considered the inflammatory disorders of the musculoskeletal system. And so we already named the osteoarthritis, which affects more of those large weight bearing joints in a person as they age. Causes a lot of pain and stiffness. We talked about rheumatoid arthritis. Rheumatoid is actually considered an autoimmune disease, and we've talked about this in previous chapters. It can occur at any age. If you remember what autoimmune means, when the body begins to attack its own organs and its own joints. Diagnostic imaging and blood tests that detects inflammation are usually used to diagnose arthritis. Arthritis treatments include anti-inflammatory. We're going to learn a lot more about the anti-inflammatory medications is used to treat any type of disorder that causes inflammation. And so we'll be able to name some of those once we get to that exciting pharmacology chapter. Local applications of heat, range of motion exercises, which we just named some of those different exercises, a regular exercise routine, and diet changes. So, patients with rheumatoid arthritis may require NSAIDs, again, non-steroidal anti-inflammatory drugs. We'll talk about that in the pharmacology chapter. Steroids or disease-modifying anti-rheumatic drugs to slow that disease process. We talked about gout. It is caused by a buildup of uric acid crystals in the joint. Again, this comes from diet. Treatment includes diet changes and medications to reduce uric acid. You'll learn too as you go throughout the program that uric acid is one of those blood tests that we perform to see if the person may possibly have gouts. You'll notice there's a blood test for that, and you may see elevated uric acid levels. Bursitis typically affects the elbow, the knee, the shoulder, and the hip joints due to overuse or a bacterial infection. And so, again, treatment includes rest, those NSAIDs, steroids, or an antibiotic. Tendonitis is caused by overuse of a joint, which causes pain and reduced range of motion. Treatment includes pain medication and also those anti-inflammatory medications. And so you'll notice that a lot of the disorders that causes inflammation will be using a lot of the anti-inflammatory drugs. And then you have your plantar fasciitis, which is caused by stress of the foot. Symptoms are relieved by stretching, or again, the use of NSAIDs and also the use of those orthotics. And that kind of helps assist with the mobility. All right, let's take a look now at some of those bone deteriorating disorders. We just took a look at the inflammatory disorders. Let's look at some of those disorders that causes deterioration of the bone. And so osteoporosis is a condition in which bones become porous and brittle. And so remember, we talked about that changes of our bones over the lifespan. The bones become more brittle and causing them to break easily. And so I told you, I want you to think about what are some of those safety concerns we have if we have patients whose bones are very brittle and easily to break. And so we worry about them falling, but not only that, we worry about fractures as well. And so I always like to keep these things in mind because when it comes to the education, the teaching component of your job, these are things that we can talk about as ways to keep our patients safe and some of those things that we have to prevent so it won't cause a fracture or anything like that. And then we have the term osteomalacia. Remember, osteo has anything to do with bone, but malacia is actually softening. So it is a condition in which the bones of adults lose their rigidity and it softens. So called rickets in children. So it can happen in children as well. And so here are some things that we can look at and know and understand about these bone deteriorating disorders. We've already talked about osteoporosis, which causes brittle bones that can break easily. And yes, we do worry about fracture. Signs and symptoms can include low back pain, their posture change or stooped posture, becoming shorter over time, and fractures. So, weight bearing exercises can prevent or even slow osteoporosis. And so, treatment also includes medications, and there's even some supplements that will help with that. Osteomalacia or rickets, which causes softening of the bones, usually caused by severe vitamin D deficiency. Okay, so here we have some supplements that's needed here. That is severe vitamin D deficiency. And so persistent bone pain and muscle weakness are symptoms as well. The legs may curve outward or even bow. A diet that is rich in vitamin D, calcium, and phosphorus can help improve or even cure this condition. So, again, here are some things that we may be asked to teach as medical assistants. What are some of those foods that is rich in vitamin D? So, some things to just kind of keep in mind here. All right, now let's take a look here at some of the curvature disorders in this body system. Kyphosis is a condition in which the thoracic spine has an increased posterior curve. Lordosis is a condition in which the lumbar spine has an increased curvature, also known as swayback. And then scoliosis is an abnormal lateral or sideways curvature of the spine. And so if you take a look at page 221, I want you to pay attention at the different levels of the spine. So you have the cervical spine, which is more in the neck area. You have the thoracic spine, which is more of your curve. So that's kind of your upper back chest area. Then you have your lower back, which is your lumbar spine. And so looking at the different disorders that we just talked about, kyphosis, lordosis, and scoliosis, you can see the level of which, the level of the spine in which it affects. And so looking at those different pictures, you'll see exactly where it is. And then this actually kind of tells you where they may even begin to experience some of the discomfort. I also like to understand the different levels, cervical, thoracic, and lumbar, because when it comes to bone disorders, there's a lot of diagnostic studies along with this. So X-rays, your physician or your provider may order X-rays of the lumbar spine, and so you may have a patient that may ask you, well, what is an X-ray of my lumbar spine? You can explain that it's taking pictures, of the lower part of your spine. So it's good to understand anatomical directions or to understand the levels of the spine. So here are some facts about disorders related to the curvature. Abnormal spine curvature can cause mild to severe deformity and symptoms, which increase as the curvature worsens. All type of abnormal curvatures can cause pain. So I told you it's very uncomfortable. And asymmetry, I'm sorry. These conditions are treated by an orthopedic specialist. So we've already given the definition of an orthopedic specialist and sometimes requires surgery. Kyphosis causes a hunch in the thoracic spine and is caused by congenital conditions, another disease, or it could be poor posture. Lordosis, and again, following along your book, has increased anterior curvature in the lumbar spine. It causes the hips and buttocks to protrude backward. It causes include osteoporosis, which we've talked about, and also obesity. And again, if you're not familiar with these words, please highlight that and go back and define what that means. Scoliosis causes abnormal lateral curvature and can affect any part of the spine. It can be congenital or the result of nervous or muscular system disorders. Now, children with scoliosis should be monitored closely as they grow. And then treatments for all curvature disorders may include the use of analgesics. Again, this is what we'll learn in our pharmacology chapter. Physical therapy, spinal bracing, so that's wearing a brace, and even surgery will help as well. Okay. All right, now let's begin to look at some of those injury related disorders. Injury related disorders. And so, strains is an injury caused by damage of tendons or muscles. Sprains, these are very common, is an injury caused by damage to ligaments or the bands that connect bones. Dislocation is an injury that occurs when a bone is pulled out of the attachment point, and then a fracture is a broken bone. And so now we have different types of fractures, and you can look on page 223 and you can see the first thing you see is a dislocated joint or bone. But then also you can see the different types of fractures. So you have a closed fracture, which is a broken bone that does not break the skin. You have an open fracture, which is a broken bone that penetrates the skin, also known as a compound fracture. You also have a displaced fracture, which is a fracture in which the broken bone has moved out of alignment. And so you can kind of see top right on page 223, the displaced closed fracture. It has not penetrated the skin, but it is displaced. Okay, in other words, it's moved out of alignment. Then you may have a non-displaced. You see example of that as well, is a fracture in which the break remains in alignment. And then you have a green stick fracture, which is a partial fracture common in young children due to the softer structure of the bones. All right, atrophy is the wasting away or decreasing in size and weakening of muscles from the lack of use. And then contractures, very common, especially for those who are bedbound and do not move as often or have lack of activity. Can develop contractures, which is the permanent and often painful shortening of a muscle or tendon, usually due to lack of activity. Okay, so things to remember: musculoskeletal disorders can result from trauma and injury to the joints, bones, and muscles. The goals of treatment for these types of conditions is to keep or restore function and to relieve pain. All right, so here are some additional things that we should understand about injury disorders. Back pain is the leading cause of disability. Strains are injuries to the muscles, and sprains injures the joints. Again, look at that again. A muscle strain, strains affects the muscles, sprains injures the joints. Okay. Dislocations occur most often in shoulders and hips, and imaging is used to diagnose most injuries, and treatment plans are determined by the severity of the injury. So we will talk about some of those imaging studies. There are many different types of fractures, which we talked about, that can occur in the arms, wrists, elbow, legs, and hips. Like I said before, teaching, preventing falls is extremely important. Fractures heal when they are realigned and immobilized during the healing period. To heal completely, the bone must not be allowed to move. And so that's when you'll notice that people may have a cast put on or some type of splinting to help immobilize that area for healing. Atrophy can occur during the immobilization period, and contractures cause permanent damage. Pain management, medications to improve bone strength, and hot and cold applications are common treatment for musculoskeletal injuries. All right, so now let's look at some of the chronic musculoskeletal disorders. So, what we just looked at was a little bit more acute, short term in nature. Now, chronic conditions is something that's a little bit more long lasting. So, here's a couple definitions here. Fibromyalgia. Anytime you see the word mya, we're talking about muscles, and algia is more so pain. So this is a chronic condition of pain and tenderness of the muscles and joints. Myasthenia gravis is a condition in which impulses from the nerves are not transmitted properly to the musculoskeletal system, and it causes severe muscle weakness. And then you have muscular dystrophy, which is a term referring to a number of progressive diseases that cause a variety of physical disabilities due to muscle weakness. Anytime you hear the word progressive in healthcare, it describes a condition that will continuously get worse or it will deteriorate. And then we have something called ALS, which is amyotrophic lateral sclerosis, a progressive disease that causes muscle atrophy, so severe wasting, and will eventually lead to death. Okay. All right. So here are some facts about chronic musculoskeletal disorders. Fibromyalgia causes widespread body pain and other symptoms that can affect other body systems. There is no diagnostic test for fibromyalgia. You've probably heard of this before. The cause is unknown, but lab tests and imaging can rule out other diseases and disorders. Treatment for fibromyalgia includes medication for pain and insomnia. Again, if you're not familiar with these terms, please look them up. Physical therapy and massage therapy will help as well. Myasthenia gravis is an autoimmune disorder. So remember, we've already talked about what autoimmune means. So go ahead and rehearse that back to yourself. That causes muscle weakness and can also affect other body systems as well. Myasthenia gravis affects all of the muscles and is diagnosed by a physical exam and test. And then treatment for myasthenia gravis includes pain reduction and medications that improve the muscle strength. Muscular dystrophy is inherited. We're going to say MD for short, causes gradual wasting away of the muscle and weakness and deformity, and most forms are present at birth. MD is diagnosed by a physical exam and an EMG, which we will discuss. That's part of the diagnostic studies. Treatment for MD includes physical therapy, use of braces, and sometimes surgery. Your ALS, which has also been have been called Lou Gehrig's disease, can be diagnosed at any age. The average time from diagnosis to death, this is a very chronic disease, is 2 to 5 years. Eventually, person will need tube feeding and a breathing tube because it affects all muscles, all areas of the body. Treatment includes medication, physical and occupational therapy, and respiratory and nutritional support. Okay. And then lastly here, we will talk about tumors that can occur here or develop, I should say, in the musculoskeletal system. And so tumors are usually benign, okay? So even though we'll get a little bit more in depth when we get to the chapter that talks about cancer or oncology, but go ahead and look that term up, benign. Benign tumors may be surgically removed if they are affecting mobility and function. Cancerous tumors are rare and occur most often in children. Imaging tests and biopsies, and we learned about biopsies, I believe, in chapter 12. So, again, these terms are coming back, are used to diagnose all types of bone cancers and to determine staging and the spread. Treatment for cancerous musculoskeletal tumors includes surgery, chemotherapy, and radiation. And again, once we get to that chapter on oncology, we'll talk a lot more about chemotherapy and radiation treatments. And again, I always specify to look terms up because we've probably talked about it before, but it helps you get a better understanding of what we're talking about. As a medical assistant, you have to understand a lot of these terms, and then you're going to see it come back once you go on to take your national exam. You'll see a lot of these terms come back. So that's why it's very important to look up words. Amputation, let's talk about that. Amputation is the surgical removal of some or all of a body part. You can see a picture of that on page 226. People who have an amputation, the body part that's removed, some of them will still have a phantom sensation. What does that mean? That means warmth, itching, or tingling from a body part that has been amputated or has been removed. Some people will even have phantom limb pain. That means they will have pain in the limb or extremity that actually has been amputated. So, what are some things we need to understand about amputation? An amputation is usually the result of an injury or a disease. Patients may choose to use a prosthetic device, and you can see also on page 226, the young lady has a prosthetic device. What is a prosthetic device? Prosthesis or prosthetic device is an artificial limb that will replace what has been amputated. Patients may also report phantom sensation and limb pain, which we just talked about. And so treatments include physical therapy and medications as well. Okay. Now let's get into some of the examinations and procedures as it relates to as it relates to uh, the musculoskeletal system. Sorry about that. All right, so thermal therapy is the application of heat to an affected area for the relief of pain. So that can come in the form of heat packs or heating pads. Cryotherapy is the application of cold to an affected area for the relief of pain. We've talked about range of motion exercises, which is exercises that puts a joint through the full arc or full range of motion. Arthro. Anytime you hear the word arthro, it does refer to joints. Tesis or centesis refers to removal of fluid. So arthrocentesis is a procedure during which fluid is removed or aspirated from a joint. Anytime you have fluid on a joint, it does cause swelling and inflammation as well. And so what happens is that person may want to have that fluid removed or aspirated. Arthroscopy is a procedure performed to visualize a joint. And then electromyography or electromyography, I'll just say it that way. I'm having an issue with talking today, or EMG for short, is a procedure performed to test a muscle's response to nerve stimulus. So we're testing the response to muscles, okay? All right, so let's go back to page 226 here. We want to look at Kenji's case. Okay, so we've already talked about possible fracture in the other case study. So now let's see here. Dr. Smith examines Kenji and orders an x-ray. The x-ray shows a fracture of the tibia, the larger long bone in the lower leg. The bone did not break the skin. The bone is broken straight across and the edges are not in alignment. So how is this fracture categorized and how may it be treated? All right. So come on, my medical assistants. I need you to get those case studies completed and we'll be ready to discuss this in class. Very good. We'll be ready to discuss that in class. All right. And so now, again, let's look at some of the procedures that's related to musculoskeletal system and some other terms that we may see. Gait is how a person walks. Hemiplegia is paralysis on one side of the body. Hema meaning one side. Okay. Plegia meaning paralysis, and the paresis is weakness, which is weakness on one side of the body. Remember, hemi is one side of the body, and the goniometer is an instrument used to measure the range of motion of a joint. Okay. All right, so MAs should observe and document a patient's mobility during intake. That's important. So we've already talked about patient intake. We've already talked about the chief complaint and that initial encounter with the patient. And so one of the things that you observe is their mobility. And so at what point do you observe that? And so that moment that you call that patient back to the exam room, you're observing. That's when observation begins to start. It may be necessary to assist patients with limited mobility. And then also MAs may assist with preparing patient for an x-ray or even a CAT scan to diagnose a mobility issue. What are some things that we use to actually assist with mobility? Your book talks about wheelchairs. And so this is something that we can learn together in class, is how to work with a wheelchair. There are different types. You have manual wheelchairs that have to be pushed. Or electric wheelchairs. And so know how to use the wheelchairs, know how to put the brakes on, the armrest, the footrest. Here is something that's safety concern. Always lock a wheelchair before helping a patient into or out of it. And so again, in class, we will work with these wheelchairs. We can remove the armrest, footrest, we can do all of those things. So again, we will show you that in class, how to operate the wheelchairs. Your job is to keep your patients safe and comfortable during any type of transfers. Assist the resident as needed by having the chair close and the wheels locked. We will follow policy on how to assist with transfers. Okay, so again, this is something that we will show you in class. Okay. All right, and so falls is something that can happen anywhere. It's not just something that happens in a nursing home, a hospital. A fall can actually happen right at a doctor's office, And so if a patient starts to fall, here are some things that we need to remember. We never want to break their fall, but we want to bring the patient's body close to you and lower them to the floor. Get help, okay? Get help. Do not attempt to get the patient up on your own. Okay. And so you can see that was just a skill focus on page 228. But now, other things that we can use to assist with mobility are canes and walkers. And again, we have plenty of these in our skills lab. Make sure canes and walkers are in good condition. The patient should always use their cane on the stronger side. Patient should place both hands on the walker, and the walker should be placed no more than 6 inches in front of the patient. Do not hang purses or anything on walkers. That is so important. And if cane or walker seems to be the wrong height, these things can actually be adjusted. There are so many different types of walkers out there. You have walkers that have 3 wheels, you have walkers that have 2 wheels, walkers with no wheels. Those are your standard walkers. So I tell anybody, just know how to use them. Just know how to use them. And so again, we'll show you that when we are in class. And so then lastly here, the benefits of heat and cold therapy, which we talked about, and review the RICE acronym for treating strains and sprains. So if you remember muscle strains and sprains of those bones or joints, what we do, and this is something very important for the medical assistant to know, is we use the RICE acronym for strains and for sprains. And so what does that mean? R stands for rest. So if someone has twisted their ankle, first thing we want to tell them is rest the body part that was injured. You don't want to keep walking on that injured part because it can definitely cause further damage. Okay. The next thing you want to tell them is ice. Apply ice to that area. Then C for compression. We can wrap the injured area with a compression bandage. And then E is for elevation. The area should be elevated above the level of the heart. So whether they're putting it on pillows or something like that, you want to make sure that it's elevated at heart level. Some providers may prefer to encourage careful movement and limit the use of ice, which may slow the healing in some cases. So again, it is a preference of the provider. The preference of the provider. All right. And then some other guidelines as it relates to um, hot and cold. Place a cloth between the patient's skin and the cold or hot pack because ice does burn. Okay, and so does the heat. Monitor the skin to ensure temperature of the pack is correct, and then just leave the treatment in place for no longer than 20 minutes. And so as we close out here on page 235, we're closing out with Kenji. So let's go ahead and read here. Dr. Smith decides to apply a cast to Kenji's right leg. Explain how Rick will prepare for the procedure and assist during the cast application. Kenji will need to use crutches to prevent weight bearing on his right leg for 6 weeks. And so describe how Rick will measure the crutches and teach Kenji to use them. So again, we will use some of these in class. And then what are some of those education topics as it relates to the musculoskeletal system? And so we've already kind of talked about that, knowing how to use those mobility devices, the proper posture and body mechanics. We talked about preventing falls. Okay, so we can prevent fractures as well. And so these are just educational topics that we've talked about throughout. But also, what's important is eating a healthy diet. We did say that some of those supplements are really important. For example, vitamin D is really important for bone health and structure. Carbohydrates are good. It's a good source of energy. Calcium is very vital to maintaining the structure and strength of bones, as well again as the vitamin D, which enables the body to absorb that calcium. So knowing and understanding where does these sources come from? Where does calcium come? What are some good sources of calcium? Good sources of vitamin D. We always encourage exercises. Staying active is very key to keeping those bones and muscles strengthened. And then also cast care is very important. You may have to provide education related to applying bandages, splints, or braces, or even caring for casts. Patients with casts should be told to keep their cast clean and dry. Do not wet it. Do not, insert things underneath the cast to try to scratch it or anything like that. So you want to make sure that you're having these conversations with them. A lot of this information can be found in brochures in your physician's office. And then as we close out on page 236 with Kenji, after Kenji's cast application, Dr. Smith directs Rick to instruct him on proper diet, cast care, and how to perform isometric exercises. And so again, what we just talked about, what types of foods should Kenji be encouraged to consume for bone healing? And then also describe that cast care. So come on, CMAs, I want to see what you have for your case studies. This is really going to help you, push you to really understand and critical think as it relates to the musculoskeletal system. So this has concluded our chapter on the musculoskeletal system. As always, if you have any questions, feel free to email your teacher. You can write your questions down. And when we have our discussion in class, we can discuss whatever it is or the questions that you may have. I will see you in our next chapter as we discuss the nervous system and its related care.